So chiropractic is the removal of interference from the nervous system by repositioning the bones in the spine. So due to certain stressors in our lives, whether they're from slips or falls or physical traumas, or whether they're chemical stressors or even emotional stressors, the bones in our spine or in our structure can actually shift and misalign. When those misalignments happen, that's what we as chiropractors call subluxations. So what we do is we treat those subluxations by restoring the normal positioning of those bones to allow that nervous system to function as optimally as possible for you. Absolutely. We do see a ton of postural distortions, more so typically in the elderly population than a younger population, because postural distortions set in over time. So gravity tends to break the spine down, postural distortions set in, and that causes stress and tension throughout the whole nervous system. Then your overall health can progressively weaken and decline. So what we do is we work to correct the postural distortions with exercises, stretching, and with chiropractic care to improve the overall quality of life for the person. We also see a tremendous amount of low back pain that comes into the office because that's what chiropractors are typically known for. So that's what we do see a lot of that as well. But we also see neck pain, shoulder injuries and shoulder pain, and a lot of knee pain in our elderly patients too. And with that, we can help restore the proper alignment to improve the function, to then in turn improve the quality of life for all of those symptoms. A lot of times, patients will feel the benefits from their very first treatment. But I like to say it took more than one day for the structure to deteriorate to the position that it's in. It's going to take more than one day for it to correct. It's like, I like to say, it's the healing process. It's not the healing miracle. Miracles are great and we love when they happen. But typically a patient can start to see benefits even from the first treatment. As we start to restore and remove interference on that nervous system, they'll be able to regain function. They'll start noticing like, oh my gosh, my arm, I was able to lift it up to here today, or I went to put on my jacket and I didn't wince in pain, or I was turning around to back out of my driveway and I could actually do it. You start to notice these little small things that begin to add up to a higher quality of life with each and every treatment. But it can be an ongoing process. It all depends on what the condition is and how bad it is when we get there. So it's variable. Absolutely, yes. I mean, it's used for acute or chronic conditions, or even for wellness care. So that's really what the ultimate goal is to take people from an extremely acute state where they come in with an injury of some sort. That's awesome. That's what got them there into the office to get to the treatment, to seek the treatment. That's the beginning of the journey. From there, we move them from acute care, get them out of that chronic crisis, or that crisis. If they have any chronic conditions, we work on the chronic conditions then at that point as well. And eventually we move them into more of a wellness type care. Once we resolve that first acute injury, then we can begin actually remodeling and restoring function to not only the spine, but to the other extremities and to any other areas of the body where some disease is set in, and actually get it to heal and function at a higher level. Medicare actually does cover chiropractic adjustments in a certain extent. They won't pay for maintenance adjustments. However, if you have any acute conditions, Medicare will pay for the actual adjustment itself. They don't cover the cost of exams or x-rays or things like of that nature, but they do cover the cost of the actual adjustment, which is very nice for most seniors because they rely on that Medicare, and Medicare has found that chiropractic is a beneficial and useful form of treatment for the management of low back pain and many other conditions. So that's why they do actually cover it for seniors as well.